Good morning, respected chair, co-chair, distinguished scientists, and fellow colleagues. I am Vasan from Department of Pathology, Cerebral Agricultural University. Today I am pleased to present our recent study of serological evidence of food and mouth disease in sheep and goats in selected districts of central Bangladesh. This study was recently published in Veterinary Medicine and Science Journal. So, foot and mouth disease is one of the most important and highly contagious disease that has death of cloven animals, including cattle, sheep, goat, buffalo, and other wild ruminants. And it has huge economic significance because it causes huge economic losses in the livestock industry. Although in sheep and goats, the clinical disease is frequently mild or not apparent, but they may play a significant role in the epidemiology of FMD. And importantly, the infected sheep and goats may shed and excrete considerable amount of foot and mouth disease virus, and they may also act as carrier. And this is importantly relevant in case of Bangladesh, where cattle, buffalo, sheep, goats are reared in mixed farming systems. Therefore, overlooking sheep and goats in the FMD surveillance might create important gap. However, in Bangladesh, the surveillance studies of FMD are mostly focused on cattle and buffalo, and there is a lack of evidence regarding exposure of sheep and goats in FMD, particularly serological studies. In contrast, previous studies from FMD endemic countries have reported the exposure of FMD in sheep and goats. Therefore, we had a simple but important questions. Are sheep and goats also exposed to FMD in Bangladesh, and what are the risk factors associated with the exposure? Accordingly, we had two objectives. The first one is to determine the FMD seroprevalence among sheep and goats in the selected districts of central Bangladesh, and to identify the associated risk factors with the seropositivity. So for this, we did a cross-sectional study from July to December 2023 in three districts, Dhaka, Gazipur, and Nasuti. And we included 372 small units, including 332 goats and 40 sheep. The animals were unvaccinated, FMD unvaccinated, and apparently healthy, and they were more than or equal to 6 months of age. And we collected 5 ml of blood sample from the selected animals, and we separated serum for the laboratory testing. And to detect the antibody, FMD antibody, we used commercial 3ABC non-structural protein ELISA kit. And we analyzed the data for statistical analysis. We used our programming software. Initially, we used chi-square test to assess the root association of the proposed risk factor. Then we used univariate analysis to screen the variables for multivariate analysis. For multivariate analysis, we used fit-analyzed logistic regression. And this study was approved by Cerebral Agricultural University Animal Experiment and Ethical Committee. So in result, we found overall seroprevalence of 20.97%. In total of 372 small units we tested, we found 7 positive for 380 non-structural protein antibodies. And importantly, sheep had higher seroprevalence rate than goats. And we, in case of animal and herd-related factors, we didn't found any major difference in the seroprevalence. In case of age, the older animals had slightly more seropositivity. That explains the increased chance of exposure to the older animals. However, in case of geographic factors, we found variation in case of ecological zone and districts in river basin areas. The animals, the sheep and goats had higher seroprevalence. Then we analyzed the factors related to the management. The animals that are managed in grazing system had higher seroprevalence than those who are kept in a stall feeding system, and the animals these factors and the findings suggest that the animal movement increases the contact and increases the risk of transmission of the disease. Finally, we used multivariate logistic regression using fit-analyzed logistic regression to identify the independent risk factor associated with the seropositivity, and we found that SIP had significantly higher odds of seropositivity than the goats, and in comparison to stall feeding grazing of the animals independently associated with high odds of seropositivity, and the animals from behavior areas had higher seropositivity, and the animals from Gazipur district had significantly higher seropositivity. So these findings, based on the findings, we conclude that this is the first serological evidence of FMT growth among sheep and goats in Bangladesh, and we found overall seroprevalence of 20.97% in unvaccinated and apparently healthy sheep and goats, and from the multivariate regression analysis, we found 5 independent risk factors associated with the seropositivity that were the sleep, nursing and Gazipur district, the grazing system, and evaporation ecology, and introduction of animal in herds. So, based on the finding, these findings suggest that overlooking sheep and goat from the FMT surveillance is not good. So, we should not overlook these animals from the FMT surveillance, and we suggest that sheep and goats should be incorporated in the national FMT surveillance programs and future FMT control and in vaccination strategies. I would like to acknowledge Ministry of Science and Technology for the funding, Bangladesh Livestock Research Institute for the logistic support, and our students of the faculty and Volunteer Livestock officers of the study. Thank you for your attention, and happy to take any questions.